All right. Well, good morning, everyone. It is another fantastic Monday morning here at Healthline Markets. Thank you guys for being on the call this morning. Uh, as we normally begin, you are here, hopefully, besides a paycheck, is being part of our mission. And that mission is to improve the lives of our community with affordable healthcare. Thank you very much for being a part of that mission. And thank you for being on this call. I know many of you have an AEP hangover. Hopefully, you had a very nice long weekend as AEP came to a close on Thursday night at 12:01, and I have seen phenomenal results from everyone. Really proud of those folks that again have stuck out another AEP with us. I've seen true growth across the entire company. I've seen agents here that have outperformed what they did last year. And saw some great rookies that came in and did a phenomenal job. So wherever you are in that order, congratulations to you and great job. However, we still have quite a bit of time left to hit those ones because everything counts for ones from now until. So, just keep that in mind. If you do come across somebody that is still calling you, texting you, emailing you, hey, I might need help. We're going to talk about SEPs this morning specifically, and how you can keep that momentum going, now until the end of the year, as well as, kicking it up in OEP as well. So we'll talk about that. We also have a special guest from InnovaCare. Mr. Francisco will be joining the call in just a few minutes, and we're going to give him the mic to talk about InnovaCare and all the great provider groups that they have as they continue their growth across the country. They've been excellent partners for us at HPM. And if you haven't yet met or talked to them, this is your opportunity to do so as they continue to grow throughout the US. So, with that, we want to continue to keep one foot in the classroom and the other one in the field at all times. So, for the moment, let's go ahead and jump into the training calendar, and I will show you what's going on this week at HPM. So later today, you have Gold Kidney. They're going to pop up at 11 o'clock. They're doing a special SEP kickoff. That's over in Jacksonville. So if you're in the Jacksonville market and are interested in joining that, you could check that out. Also at the same time at 11, you've got United Healthcare doing their member retention. This is really key and critical. If you haven't been to one of these trainings with member retention, I guarantee you will walk out learning something about how you should be treating your clients and how you can build a fence. Like I like to say around your chickens, how do you build your fence around your chickens so they don't get out of your yard, right? And so member retention is really key and critical in that. If you're building a book of business with any significant value, you have to keep your members in your book of business. And so the United Healthcare does it really well. So if you haven't been to one of these member retention trainings, I highly recommend it. I guarantee you will learn something and hopefully implement something to help you keep your members. Also, okay, so moving on to Tuesday the 12th at 11 o'clock, we got Gold Kidney. They're doing another SEP kickoff, and that's at Zoo Tampa in the Tampa market. And I think they've got one more, yes, and one more on Friday at noon in Sarasota. Looks like they're doing one at the steakhouse. So if you're hungry, might want to wait off and go to the one in Sarasota there. Gold Kidney specifically is a brand new carrier, and I know we haven't had them on the call yet, but Gold Kidney is a specialized Medicare Advantage plan, and they're in pockets in Arizona and Florida, but they're growing. And one thing that makes them unique is they have a plan specifically for people that have ESRD. They also have a diabetic plan, and for folks that have chronic conditions with the heart. And so, with all of that, having that product is really great now from our mini SEP that we have until January 1st, in OEP, and then in lock-in next year. So if you're looking for more opportunities to enroll people year round, check out Gold Kidney because they're going to have some options that some of the other carriers might not have. So look at that. Moving over to Wednesday, we have our very own Al Clancy with his virtual coffee and chat session. Any questions, concerns, or anything that you need from HPM as far as training goes, please get in with Al. He is a phenomenal resource, to chat with and to help you grow your book of business. So he's available every Wednesday at 9:30. As we're running into the holidays here, you may see some of these dates change just a bit, so just keep that in mind. And then also on Wednesday, Cigna's doing their virtual office hours as well for Medicare. Again, any questions or concerns that you have regarding Cigna Medicare. And then last but not least, on Friday the 15th, we've got HPM Shop training. What about HPM Shop with our very own Tom Ryan? And he is hosting that. Again, any questions that you have regarding the our Medicare quote and enroll tool. And if you're new to it or you want to get, a little bit deeper with the software, he's available every Friday at 9 o'clock to pick his brain. And I do highly recommend it because if you want to kind of work through the process and make sure you're doing it efficiently, compliantly, which is most important, and to ensure that you're not missing any steps, that's a great opportunity for you there. Okay, that's the training for the week. Remember, guys, one foot in the classroom and the other one in the field at all times. And this morning, I'm going to talk about the SEPs. This is a gold key, guys. And as a reminder, everything that you need here at HPM should be right here in this gold key. If it's not, please let us know by shooting us an email at support@askhpm.com or give us a call at 844-696-3975. It has everything from recertification, IT trouble, resources, and contact guides for everything that you need to do this business. But one thing specifically I want to point out, and by the way, I'll go ahead and put this in the chat here for the gold key in just a bit. But one thing I want to point out on the right under activities is the SEPs. Check available SEPs. Now, guys, we have until December 31st to continue to write business for Medicare Advantage, Medicare supplements. And on top of that, we also have ACA that is continuing to roll all the way until January 15th. So there's still lots and lots and lots of opportunities, and especially with the SEPs that are happening here. So I'd like to thank John and the team for putting together this SEP page. And so he's updating these SEPs as they're coming in. So for instance, with Humana, we're opening up the Humana here, and we can see that on 12/8, they've updated their SEP, and you can click that and open it up. Not that you really need an SEP for Humana, at least in Florida, because they have 5 stars. But across the country, this is going to show you what SEPs, what does it mean? What exactly is the SEP? Who qualifies for it? How to process it? And in what areas are they accepting this SEP? Okay. And so you could see, like in Alabama, there was winds and lightning and hail. So that one's good until looks like January 12th. Some of these are closed, but as you're going through this, you can find these SEPs across the country. Especially if you're getting a lead outside of the state, you can go through this list and hopefully get this up to date and check it out. So that's just one resource page that I want to make sure everyone's aware of, because we will continue to update these as we get them. And so you'll be able to continue to sell year round. Now, just off the cuff here, as a reminder, what SEPs are available in general, okay, without looking at this SEP list here, you're going to have 5-star plans, okay? So now keep in mind that if you use a 5-star designation now in December for a 2024 plan, you are using that individual's 5-star selection for the entire year for 2024, which means if you select a 5-star plan and you use 5 stars the SEP today and you enroll them for 1/1, they will not be able to change to another 5-star plan for 2024. So you want to kind of use that as a last resort for your clients, because if you burn it now, they're basically stuck unless they have another SEP across the board there. Okay. So keep that in mind. We've got quite a few 5-star plans, and I'm just going to talk about the ones in Florida, but across the country, you've got 5-star plans in different pockets of the country as well. And we are searching for those particular plans. Just really quick, I've seen Kelsey Care in Texas, Devoted in Ohio and Florida. But in Florida, we've got 5-star plans. Devoted is here with 5 stars. We've got Optimum Health with 5 stars. We've got Humana with 5 stars, and Simply Healthcare with 5 stars. So unbelievable job there with the 5-star products. And so, you know, as you're going out there, just remember if somebody bumps in and says, "Hey, I missed open enrollment, I missed AEP, and I need to get a plan, I need to change." You could still get that done. Just let them know, "Hey, if I use this 5-star, you know, you're going to be on this plan for 2024." Now, with that said, you still have OEP. Okay, so OEP is from January 1st to March 31st. And if you enroll them in a 5-star plan and they say, "You know, this isn't the one that I thought," and they call you back during OEP, then yes, you can change them to another plan, including another 5-star. You just can't use the 5-star designation. It'll get rejected because they've already used 5-star as a designation. At that period, you can use OEP as a designation because they want to change from one MA to another MA. Okay. So I know it gets a little bit tricky. Again, if you have questions or concerns, you're just not sure, please call or text us. We're happy to straighten that out with you as well. Again, some more SEPs here. You have Medicare and Medicaid, big one, okay? We have Angie here in-house. So if you have somebody that needs to apply for Medicaid or you need to check their Medicaid status, you can call us or email us at support@askhpm.com and Angie will get on it. If you've got Angie's direct line, fantastic. Give her a call and she'll help you process Medicaid applications and get you up to date on that. We have chronic conditions, diabetes, chronic lung disease, cardiovascular diseases. We have ESRD. So if a person has kidney failure, we now have a plan for those people as well. You've got T65s. You've got people that are moving in. Lots and lots of SEPs available. And if you need a cheat sheet, one of the best ways to remind yourself of all of these SEPs is if you have a paper application laying around somewhere, on one of the pages there, there's a full page of all the SEPs that are available. You've got disaster SEPs from weather that we were just talking about. You know, one thing about the weather SEPs I want to mention is that it is up to the carrier to accept which SEPs they're going to allow their members to use for CMS. So just keep that in mind. Not every SEP is accepted by every single carrier. Okay. Again, we're going to do an SEP training and go in depth with all of that. But I have a special guest on the line. I have Mr. Francisco Rivera. And can you hear us, Francisco? You can? All right. I don't think we have audio from you yet. No. We'll wait for him to maybe reconnect there. But in the meantime, I will do the quick intro. Francisco is from InnovaCare, and he is the fearless leader there. And he's going to introduce himself in his role. I know many of you haven't yet got the chance to meet him, but he is in charge of the InnovaCare brand, which also includes Orlando Family Physicians. You have Family Care Partners in Jacksonville, and then Trinity Medical Group. Those are the big ones that I'm aware of, at least in Florida. And I do know that they've got other brands and other locations across the country, I think also in Texas as well. So I know you're still toggling with that. I think we got you. Maybe?
Okay.
Yeah, we got you.
Me?
Yes, sir.
Finally.
How'd I do?
Very good. Thank you guys for having me here, and thank you for that kind introduction. Again, my name is Francisco Rivera. I'm the National Broker Manager for InnovaCare, currently in Florida and Texas. But again, first of all, congratulations to everyone here in this call. Hope you had an outstanding AP, and good to see you guys plugging into this very valuable meeting and to keep the pedal to the metal for the rest of the year. And so thank you, Justin. Thank you, Sergio, Nick, Lina, for all the support you guys give us. Al, we are really grateful for this partnership and looking forward to keep strengthening and growing with you guys. So with that said, first of all, I want to say congratulations to and thank you. We just started using the Connector platform. By using Connector, we have the capability of receiving the patient's file. Any new patient that you refer to us will come on a nightly file directly to our CRM, which is amazing because that way we can keep the writing agent as agent of record. And I'm going to talk a little bit more about that. But we found in this process that there's another way for you to submit the patients that we do not get the patient's information, but we do see the agent of record. Then, we started an exercise with Sergio, with Gabe Diaz to help us identify those patients, which again, I'm going to talk a little bit more about that, but I was able to see names that popped multiple times, and I'm going to mention, Adalberto Negron, Juan Carlos Tuato, Liz Caballero, Mary Bornachera, like their names came a lot through those files, so we're really, really thankful for trusting your patients to us. With that being said, I'm going to cover two things basically here. First of all, for those of you that do not know about us or have heard about us a little bit, I'm just going to go very high level on who's InnovaCare, where we at. I'm going to be sharing that deck with you, Justin. Mm-hmm. And again, feel free to this. It's compliance approved to be given to brokers, so you can pass it. You can put it on your portal. Mm-hmm. Again, it's very easy tool that is updated on a monthly basis. That if you're wondering, okay, what if InnovaCare has a clinic in this area? You can just go in, click, find out, look at the plans that we accept, the services provided, the sales reps, etc. So I'm going to share that. I'm going to go very high level with you guys right now. So to walk you through the process on how to read this deck. But again, I'm going to send it to Justin, and Justin, feel free to share it with your team.
You got it.
Let me look at the file. Give me 1 second. It's been a while since I haven't used.
Oh yeah, Ring Central. Yeah.
Ring Central. I love it, but it's been a while, so
no problem. Take your time.
Find out the document.
Yeah. So one thing while he's pulling that up, Francisco mentioned Connector, and that's the company that has built HPM Shop. So our team knows Connector as HPM Shop. And so what he was mentioning is every time that you do an application for InnovaCare, any of the InnovaCare provider groups, that patient information goes right into their system, which is phenomenal. So typically what would happen before, it would go to the carrier, and then Francisco would have to chase the carrier down for patient information, and that always made it very difficult and time consuming. And sometimes what happens is those members end up in the hospital, and they never got a chance to see them. So having that information directly to the provider is phenomenal. So we could see your screen, but we're seeing the video there.
So are you seeing the InnovaCare presentation?
No, we're seeing the video screen here.
Okay, so for some reason I'm having. Okay. Why I can't see the document? So if I send it to you, will you be able to? It will be. I think it will be faster.
Yeah, I think so.
If I just let me do that right now.
You got it.
I'm sorry, guys, for this.
No, take your time. So so while he's sending that over, um, the shop files are going in there as again, as we were talking, to protect you as agent of record as well. And so one of the things that we're doing is just kind of buttoning up and making sure that all of that matches on both of our systems. So that way, if one of your members calls in to InnovaCare, it goes right back to you.
So I just share it with you.
Okay. Yeah, just waiting for my email to refresh here.
So yes, guys. So just Justin received it. Right now we have 35 clinics in Florida. We have 8 clinics in Texas. We actually had a new acquisition, Nature Coast Medical Group in Williston, and we have 3 in the works in the Texas area. On the deck, once Justin is able to send it to you guys, you're going to have a hyperlink that if you want to find any of our clinics, you just open that hyperlink, you click it, and it will show you a Google Maps with all our locations throughout Florida and Texas. That presentation will have each of our entities, like for example, most of you know Orlando Family. So Orlando Family has currently 14 clinics. So when you see the slide that shows Orlando Family, you're going to see the 14 clinics addresses. You're going to have all the accepted insurances per clinic, and you're going to have an additional slide that shows all the services provided in that respective clinic. And that will be the same. That's the trend on the report. So you will see the entity. Okay, since like there you go. So if you go to the slide number 2, the next one.
Mm-hmm.
Okay, you're gonna see, first of all, again, InnovaCare is an established company. It's been in business for many years. So we have over 45 locations, 175 providers. And why we encourage brokers to work with us? First of all, we support your own client onboarding experience and customer service. So when you refer a patient to us, immediately we're going to attach that patient into the CRM with you as agent of record, so we can actively and intentionally protect your book of business. And we will immediately reach out to the patient, do the onboarding, get them scheduled, get their appointments done, help them with transportation, any needs that they have. What we really want to be is your customer service concierge. Like if the patients are having issues with the clinic, they're missing appointments, they need transportation, they miss a referral, we want them calling us. We don't want them taking, using your time. We want them to call us, and we will take care of them. Now, something that I want everyone to understand: we do not hire licensed people to be sales reps for us. So our representatives, they do not have license. Every time that the patient requests assistance, they have doubts with their benefits, they saw an ad on TV, they are confused about their benefits, we will always refer those patients back to the agent of record. So that's the reason why we are very we're very aggressive on trying to identify that agent of record, because that's our promise to you guys. Obviously, this reduces patient turnover for you, reduces patient turnover for us, makes their healthcare more complete, and so that's the reason. So in this slide, the InnovaCare Health locations, that's a hyperlink that if you click it, you're going to see a map that will show all our entities throughout Florida and Texas. Next slide, please. Essentially, it got frozen.
Nope, it got frozen. Okay, I'm seeing the Family Care Partners slide here.
No, I'm not seeing it here. Essentially, the image got frozen.
Okay, let me stop. And
so stop
it
there.
worked.
Yep,
oh, sorry.
Oh.
I got you. Don't worry.
Yeah. So what I'm going to show you right now, again, this is the only entity I'm going to talk about, so you guys see the pattern of how the deck it is. So this is our family care partners in Jacksonville. So per market, you will see a slide like this that has all the locations, their address, and the accepted insurances. Okay, very easy. If you go to the next slide.
Well, it might be delayed. Sorry, Francisco.
Yeah, it's taking some time, so no worries.
Yep. Yeah, while
So
this is loading.
the next slide.
Go ahead.
Mm-hmm.
Go ahead.
Go ahead.
I was just going to make a quick note
the next
that
slide, you will.
Sorry, the family care partners. We have you have 2 locations on Dunn Avenue, and we have an office on Dunn Avenue as well. So just wanted to point that out.
Perfect. So I'm going to make a note about that because, again, it gives us an opportunity to build there more collaborative activities. So, again, the next slide will always be the benefits, all the services in the respective clinic. So, again, for the purpose of time, I will not go over this. You guys will receive it from Justin. So you will see the entity, address, accepted insurances, and all provided services. And then the last slide, you will have, again, the hyperlink that shows all the entities and 2 QR codes, one that shows our sales team and one that shows the provider directories. So you will be able, with a QR code, see the provider directories for all our PCPs with open panels in Florida and Texas. So with that being said, I'm going to go back again to why the importance of identifying the agent of record and getting the patient's information. So once you sign up a patient, that you visit the patient, you do the needs analysis, and you identify that one of our clinics is the best option, and the patient decides to come in, you assign that patient to us. So there are 2 ways. You can go through Connector, and in Connector, you can either, on the preferences area, select the start of selecting the PCP, and that will trigger that the file will transfer automatically to our CRM. We receive a notification that Justin Jacobs sent Mr. Francisco Rivera effective January 1st with the voted or whatever plan to this clinic. Immediately, we're going to do the onboarding process. We'll take care of everything. Okay? And again, if the patient has any questions that is triggered because of all the ads, all the marketing, if they have any questions, we will always go refer Francisco Rivera to a writing agent, Justin Jacobs. So that's one. The other thing is that what we learned is that currently, if you go through Connector, through the enrollment area, not necessarily, we're not going to be seeing the member's information. We're going to see the agent of record. So what we do is that we send that information to Gabe, and Gabe identifies that patient. So again, we're going to be calling that member to welcome them, do the onboarding, get them scheduled, do all the process, and make sure that we are attaching the agent of record to that patient. Now, there's the old way. The old way is for those of you that are doing the paper apps, that are using the carrier's portal directly. If the patient has decided to and agrees to come to us, we will ask you, so Mr. and Mrs. Patient, listen, so we're going to send you to Orlando Family. Within the next 24, 48 hours, a representative will call you to welcome you and do the onboarding. And obviously, if the patient has accepted to come to our clinics, they will be willing to accept that call from us. So the only thing that we're requesting, if you're not using those platforms, if you're doing another type of app, just reach out to us. It can be me, it can be any of our sales reps, and you will get all their information in the deck. You send us the patient's name and phone number. We'll reach out to them. The only thing we're going to do is say, hey, Mr. Rivera, Justin Jacobs from Health Plan Market, he wrote you, assigned you to our clinic. Welcome. And we will get all their information directly from them. Okay? Everything we need is make sure that we are contacting them in a timely manner, They will provide us everything else. We don't need for you guys to send us absolutely everything. The only thing we need is the name, a good phone number, and the effective date. Why the effective date? Because we want to make sure that we are getting them scheduled in a timely manner. The thing is, in full transparency, some of the best brokers out there, they just call the clinic and get the patient scheduled. Reality is, no matter which clinic, most of the clinics, you have a hard time getting a hold of the clinic. When you do it through us, first, we're attaching you as agent of record. Second, we are going to be doing that concierge type enrollment, and we have a direct access, the back door to get them scheduled. We're going to be asking certain questions to see if there's a priority, an urgent need. So again, there's so many things that we can do for quality of service that at the end of the day, it's going to help you guys to retain your book of business. So I want to be very, I'm going to comply with my time. Again, Justin, Sergio, Nick, everyone, thank you for this time. You're going to have my information in the deck, so feel free to reach out if you have any questions.
Outstanding. And don't leave yet, Francisco. I've got I want to share with the team what he was talking about with the actual providers from HPM Shop. So can you see the screen there, Francisco?
Yes.
Okay, great. So what we discovered is InnovaCare will only get the information if you select the primary care doctor at a specific point. Otherwise, we kind of have to go through a different channel to get this information passed over to the provider group. So this is a fake account. This is Joe Dirt, and Joe Dirt is searching for a doctor. So when you're in the preferences, you can get there by either going through add preferences, or you could skip over to the providers section up here at the top right. You're going to click providers, and then you could see that he's selected Dr. Jose Maza, which is an InnovaCare doctor. But it's very important that it shows the star that you have selected him as a primary care doctor. If you don't select him as a primary care doctor and he's just showing up there as one of the doctors, you have to select primary care doctor. Okay, it's really important. You can see all the locations that he is currently servicing. So so let me update this to see if that shows it. So you'll see here, it says set as primary care doctor. So if you're skipping over this section in the preferences, or if you're getting to the application because they, maybe they don't have a doctor, I would recommend just going back here, finding the doctor in the preferences section, and then selecting set as primary care doctor like I just did like that. And that is how it's seamlessly transitioning that information over to InnovaCare. So I hope I explained that all right. And Francisco, I know that we had talked about that in the past, and we understand that some agents may be enrolling folks without doing this process. So we're kind of doing some cleanup with the data. But for your client to have a seamless experience and for InnovaCare to recognize you as the agent of record seamlessly, it's best practice to go in here, find the doctor, and then set the primary care doctor like I just did like that. So I just wanted to button that up as well. And then lastly, before we let you go, Francisco, you see the market in a very unique perspective. You understand how FMOs work. You've been in the business for a while. You understand the providers. You see how the agents are integrating. You see top producers. And you've seen success out there from your perspective. So for my team on the call, we have some rookies, we have some veterans, and we're getting ready to go into a choppy part of the year with the holidays and then gearing up for OEP. So my question to you is, from a consultant point of view, what would you recommend these agents be focusing on right now? What should they be doing to work with a group like InnovaCare? What do you see that works, and what would you recommend them for them to get integrated and really take their business to the next level?
Let me tell you, that's an outstanding question. So understanding that your business is based on customer service, your business is based on providing counseling, advisement to the neediest. You want to see your business as a whole. And when you're looking at business as a whole, you need to work with a partner that truly is gonna understand
Mm-hmm.
what isn't for you as well, because this is your business. You're putting a lot of time, you're making a lot of sacrifices, family sacrifices, a lot of things, financial sacrifices to build this in your future. So we need to understand that this is a win-win. It should be a win-win for your patient and also for you as an entrepreneur in this industry. So the most important thing is making sure that when you collaborate with a provider group, that you receive the support. The support is marketing. The support is customer service, and obviously retaining your book of business. The reality is there's a lot of competition. Like actually, we're working right now on that report for to close the year and work on our budget for 2024. And per market, we're identifying 12 competitors average. So you guys, you should identify which of those 12, 14, 15 entity providers group outside, which one is really first has I remember the movie Jerry Maguire, the Quan, the whole thing, which is great doctors, because first thing is what your patients need, having good care, great reputation, and having the customer service to support your growth. Because if you're sending patients to a providers group that you have to be doing a lot of damage control, it's your time that you are less productive. Now, the way we are working with patients intentionally and actively is collaborate with us, collaborate with our outreach, with our patient care advocates, with the sales managers, broker managers. We will support your patients onboarding. We're going to take care of your customer service, and all those are going to help on your retention. I'm going to tell you, and using your example specifically, I understand that this AEP in general has been slower than other years. There's a lot of different things happening, but something I can tell you, we had an amazing, outstanding retention, and that says a lot. Okay.
Yeah.
And what we're asking, when we're asking you to share your patients, phone number and name so we can get them scheduled, is because we want to make sure that you retain your book of business. So again, there are many groups out there. We're not perfect. No group out there is perfect. If you're going to be building, if you're making so many sacrifices, work side by side with a group that is going to intentionally and actively help you protect your book of business, and that has this type of open lines of communication between your respective leaderships. It's an amazing industry. It's very rewarding. And if you do it this way, you're going to be changing a lot of lives. And by the way, by providing your excellent service plus referring your patients to excellent companies, you're going to be opening up the door for more referrals, organic referrals. So that's what I can share with you guys.
That is amazing advice. Amazing advice. And I will tell you, when I was selling back then, it was Orlando Family Physicians, and every patient that I put in there, they kept them with amazing aggressiveness. They did not let the patient leave without understanding what happened. And they did and continue to protect my book of business that was out there. And it's not just hearsay. It's not just Francisco telling you that. The organization itself is very aggressive with retention, because just like if you lose a member, you lose livelihood. And it's even worse at the provider group. They lose way more than we do on the on the care side as well. So point of the story he was making is make a relationship with the provider groups at several levels, and you will be rewarded with opportunities. So, Francisco, thank you very much for staying over time. We really appreciate that. Again, guys, if you have any questions or if you have any ideas or you want to partner with InnovaCare, we will connect you. Just shoot us that same email, support@askHPM.com, and then I will make sure that everyone gets the InnovaCare deck that you have graciously shared with me, Francisco. I appreciate it, buddy.
Very good. Thank you, everyone. Thank you for having me, and have an amazing rest of the year, and happy holidays to all.
Yeah, happy holidays to you. I'm in the spirit already. I'm wearing my Christmas gear. We're doing our party today. So
Very good, guys.
anyway,
See ya.
all right. Happy holidays, Francisco. Thank you very much, buddy. Okay,
Okay.
everyone. That's it from us. We will host the next call, same time, same place, same channel. We really appreciate everyone being on these calls live. And as a reminder, I know you're going to have your in-laws and outlaws coming into town. Uh, so if you miss one of these calls, just remember it is being recorded on YouTube for you to digest later between cookies and ice cream and all the fun stuff that we have for the holidays. So I wish everyone a fantastic week. Don't forget, you can still be productive. Go out there and crush it. Please know that we're here to help. Thank you all. We'll see you next week.